Have you ever wondered why we hear so much about diabetes, especially when it comes to our parents or grandparents? It's a huge topic, and it can feel a little overwhelming, right? Well, today, we're going to break it all down. We're going to talk specifically about diabetes in older adults, what makes it different, and most importantly, what we can do about it. Stick around, because this information could make a world of difference for someone you love, or even for yourself down the line. So, let's start with the basics. What exactly is diabetes? In simple terms, it's a condition where your body has trouble managing blood sugar, or glucose. Glucose is our body's main source of fuel, and a hormone called insulin acts like a key, letting that glucose into our cells to be used for energy. With diabetes, either the body doesn't make enough insulin, or it can't use the insulin it does make effectively. This causes sugar to build up in the blood, which can lead to serious health problems over time. Now, why is this a particular concern for older adults? Well, as we age, our bodies change. Our pancreas might not produce insulin as efficiently as it used to. Our cells can also become more resistant to insulin's effects. This is a natural part of aging for many people, which is why the risk of developing type 2 diabetes, the most common form, increases significantly as we get older. In fact, a huge percentage of people with diabetes are over the age of 65. It's not just a coincidence, it's biology. But here's something you might not know. The symptoms of diabetes in older adults can be sneaky. We often think of classic signs like being super thirsty, frequent urination, and unexplained weight loss. While those can happen in seniors, the symptoms might be much more subtle. They might feel unusually tired, experience more frequent infections, have blurry vision, or notice that cuts and sores are healing very slowly. Sometimes, these signs are dismissed as just getting older. But they could be important clues from the body that something is off with blood sugar levels. That's why regular checkups with a doctor are so critical. A simple blood test can reveal what's really going on. Let's dive a bit deeper into the two main types of diabetes you'll hear about. Type 1 diabetes is an autoimmune condition where the body attacks its own insulin-producing cells. It usually starts in childhood or young adulthood and is less common in seniors, unless they've had it their whole lives. The real giant in the room for this age group is type 2 diabetes. This is the one where the body either becomes resistant to insulin or doesn't produce enough of it. It's strongly linked to lifestyle factors and genetics, and its prevalence skyrockets with age. So, what happens if diabetes isn't managed well in an older person? The risks are significant. High blood sugar over long periods acts like a slow poison, damaging blood vessels and nerves throughout the body. This can lead to some serious complications. Heart disease and stroke are at the top of the list. In fact, people with diabetes have a much higher risk. Then there's kidney disease, which can progress to the point of needing dialysis. Nerve damage, called neuropathy, is also very common. It often starts as tingling or numbness in the hands and feet, but it can become painful and lead to a loss of sensation, which increases the risk of injuries going unnoticed. Another major concern is eye health. Diabetes is a leading cause of blindness in adults due to conditions like diabetic retinopathy, where the blood vessels in the back of the eye are damaged. It can also increase the risk of cataracts and glaucoma. And let's not forget about foot problems. Poor circulation combined with nerve damage means that a small cut or blister on the foot can turn into a serious infection or ulcer, sometimes even leading to amputation if not treated promptly and properly. This sounds scary, and it is. But the good news is, with proper management, the risk of all these complications can be dramatically reduced. Now, this brings us to the most important part of our conversation: management. How do we help an older adult live well with diabetes? It's not about a cure, but about control and maintaining a high quality of life. The approach is a three-pronged attack: diet, exercise, and medication. Let's talk about food first. The goal of a diabetic diet isn't about deprivation. It's about balance and making smart choices. The focus is on controlling carbohydrate intake because carbs have the biggest impact on blood sugar. This doesn't mean cutting out all carbs. It means choosing complex carbohydrates like whole grains, fruits, and vegetables over simple carbs like white bread, sugary drinks, and processed snacks. Portion control is also key. Eating smaller, more frequent meals throughout the day can help keep blood sugar levels more stable than 3 large meals. And of course, lean proteins and healthy fats are essential parts of the equation. Working with a registered dietitian can be incredibly helpful to create a personalized meal plan that is both effective and enjoyable. Next up is physical activity. Exercise is like a magic pill for diabetes management. When you're active, your muscles use more glucose, which helps lower your blood sugar levels. It also makes your body's cells more sensitive to insulin. We're not talking about running marathons here. For an older adult, this could mean a daily brisk walk, swimming, gentle yoga, or chair exercises. The key is consistency. Aiming for about 30 minutes of moderate activity most days of the week can have a powerful positive effect. It also helps with weight management, improves heart health, and boosts mood. As always, it's vital to check with a doctor before starting any new exercise program. The third piece of the puzzle is medication. For many older adults with type 2 diabetes, lifestyle changes alone aren't enough to get blood sugar to a safe level. This is where medication comes in. There are many different types of diabetes medications available today. Some pills help the body produce more insulin, others make the body more sensitive to the insulin it already has, and some slow down the digestion of carbohydrates. For some people, especially those with very high blood sugar or who have had diabetes for a long time, insulin injections may be necessary. The type of medication and the dosage is a very individual thing, determined by a doctor based on the person's health, lifestyle, and blood sugar readings. And that brings us to a crucial tool, blood sugar monitoring. You can't manage what you don't measure. For someone with diabetes, checking their blood sugar at home with a glucose meter is fundamental. It provides real-time feedback on how food, activity, and medication are affecting their body. This data helps both the person and their doctor make informed decisions about the treatment plan. How often to check depends on the individual, but it's an essential part of taking control. Newer technology like continuous glucose monitors, or CGMs, can make this even easier, providing a constant stream of data without constant finger pricks. Managing diabetes in older adults also has some unique challenges we need to be aware of. For one, they may be dealing with other health conditions, like high blood pressure or arthritis, and taking multiple medications. This can complicate treatment. There's also the risk of hypoglycemia, which is when blood sugar drops too low. This can be very dangerous, causing confusion, dizziness, and even loss of consciousness. It's a particular concern for seniors, so treatment plans are often designed to be a bit less aggressive to avoid these lows. Cognitive changes, like memory issues, can also make it harder to stick to a complex schedule of meals, medications, and monitoring. This is where family support becomes absolutely invaluable. If you're a caregiver for an older adult with diabetes, your role is huge. You can help with meal planning and preparation, remind them to take their medications, and assist with blood sugar monitoring. You can be their exercise buddy. Perhaps most importantly, you can be their advocate at doctor's appointments, helping to ask questions and understand the treatment plan. Emotional support is just as important. Living with a chronic condition can be frustrating and isolating. Just being there to listen and offer encouragement can make all the difference. So, let's recap the key takeaways. Diabetes in older adults is common and often has subtle symptoms. It's primarily type 2, driven by age-related changes and lifestyle. While the potential complications are serious, they are largely preventable with good management. The core of that management is a balanced diet, regular physical activity, and appropriate medication, all guided by regular blood sugar monitoring. The goal is not just to control numbers on a meter, but to enable a long, healthy, and vibrant life. It requires a team effort, the individual, their family, and their healthcare providers all working together. Knowledge is power, and by understanding the ins and outs of diabetes, we can better support the older adults in our lives. If any of this resonated with you or made you think of someone you know, please share this video with them. It could be the first step on a journey to better health. Thank you so much for spending this time with me today. If you found this guide helpful, please give it a thumbs up and consider subscribing for more content that helps us navigate our health together. Stay safe, stay informed, and I'll see you in the next video.